How many almonds should I take daily? Should I soak them in water overnight? I have cholesterol issues. Can I take them? Do they cause weight gain? What are health benefits of almonds? And why 7 almonds? These are common questions asked by patients in clinic. Today in this video, you are going to get answer of all these questions. I'm Dr. Jimmy Anderson, and you are watching my Health Updates channel. People spend money on expensive supplements while overlooking something simple that's already sitting in their pantry. Today, we're talking about almonds, and specifically, why the number 7 keeps getting attention when people talk about eating almonds every day. Now, before we go any further, let's clear something up. 7 almonds isn't a magic number. Nutrition research generally looks at portions closer to 1 ounce, which is roughly 20 to 23 almonds. But if you're just starting out, 7 almonds can be an easy way to build the habit without overdoing it. So number 7 is basically a number which shows moderate quantity without having digestion issues, and prevent overdosing otherwise. 23 almonds are safe if you are fully healthy, doing regular exercise, and having no associated health conditions. Because almonds aren't just a convenient snack. They're packed with healthy fats, fiber, protein, vitamin E, magnesium, and several other nutrients. And what happens when you make them part of your daily diet may surprise you. Let's start with your heart. Almonds are rich in monounsaturated fats, the same type of heart-friendly fat found in foods like olive oil. Research has found that regularly including nuts such as almonds in a balanced diet can help improve cholesterol levels, including lowering LDL cholesterol, often called the bad cholesterol. Think of your arteries like plumbing pipes. Over time, unhealthy dietary patterns can contribute to plaque buildup inside those pipes. Replacing less healthy snacks with nutrient-dense foods like almonds can be one small way to support cardiovascular health. But remember, almonds aren't a cure for high cholesterol, and they don't replace medication or medical treatment when you need it. Now let's talk about blood sugar. If you've ever been told that your blood sugar is borderline, this is especially important. Almonds are relatively low in carbohydrates and contain fiber, protein, and healthy fats. That combination can slow digestion and help reduce the rapid rise in blood sugar that can happen after eating carbohydrate-heavy foods. Research has also explored how nuts may support insulin sensitivity when they're included regularly as part of an overall healthy diet. In simple terms, replacing a sugary snack or refined carb snack with a portion of almonds may help you avoid the dramatic spike and crash that can follow foods like candy, pastries, or refined white bread. If you have prediabetes or type 2 diabetes, though, think of almonds as one part of your diet, not a replacement for medication, monitoring, or your doctor's advice. And now we get to something that almost nobody talks about: your brain. Almonds are a good source of vitamin E, an antioxidant that helps protect cells from oxidative damage. Think of antioxidants like part of your body's cleanup system. They help neutralize unstable molecules called free radicals that can damage cells. Vitamin E is particularly interesting when it comes to aging and brain health. Some research has associated adequate vitamin E intake with better cognitive outcomes, although that does not mean eating almonds will prevent dementia. The science is much more complicated than that. Almonds also provide nutrients such as riboflavin and magnesium, which play important roles in normal cellular and nervous system function. So the message isn't that almonds are some miracle brain food. The message is much simpler. Your brain needs nutrients every single day, and almonds can be one small nutritious piece of that bigger picture. Now let's talk about one of the biggest misconceptions about almonds. Weight gain. I often hear people say, but almonds are high in fat. Won't they make me gain weight? Yes, almonds are calorie dense, but that doesn't automatically mean they'll make you gain weight. Their combination of protein, fiber, and fat can help you feel fuller for longer. And when almonds replace highly processed snacks, they may actually help improve the overall quality of your diet. Some research has found that adding almonds to a diet doesn't necessarily produce the weight gain people might expect, partly because nuts can be filling and may replace other foods. But there's one important catch: portion size. A small serving like 7 almonds per day can be a smart snack. Eating half a bag of almonds while watching television is a completely different story. So whether your target is 7 almonds, 15, or closer to 23, the important thing is to keep the portion reasonable and fit it into your overall calorie needs. None of these effects are overnight miracles. The real power comes from small habits that you can repeat consistently for months and years. So how should you actually eat your almonds? First, choose plain raw or dry roasted almonds most of the time. Be careful with varieties covered in sugar, chocolate, caramel, or loaded with salt. Those additions can turn a nutritious snack into something much less healthy. Second, you may hear people recommend soaking almonds overnight. Some people find soaked almonds easier to chew or digest. Yes, soak them overnight if you have such issues, but soaking isn't necessary for most people, and there's no strong evidence that everyone needs to do it to get the benefits of almonds. So if you enjoy soaked almonds, that's fine. If you don't need to force yourself. Third, pay attention to what you're eating alongside them. Instead of thinking of almonds as a magic food, think of them as part of a balanced meal or snack. You could combine them with fruit, plain yogurt, oatmeal, or another nutrient-rich food. And finally, remember that almonds aren't appropriate for everyone. If you have a tree nut allergy, you should avoid them. And if you have a history of kidney stones, or have been advised to follow a diet low in oxalates, ask your healthcare professional whether almonds are appropriate for you. Also, if you take medications or have a medical condition that affects your diet, it's always smart to discuss significant dietary changes with your doctor. So, let's bring everything together. Almonds aren't a miracle cure. They're not a replacement for medication. And 7 almonds isn't some magical number that suddenly transforms your health. But a reasonable portion of almonds can provide healthy fats, fiber, protein, vitamin E, magnesium, and other nutrients that can support a healthy diet. They may help support heart health, contribute to better blood sugar control when replacing less healthy foods, provide important nutrients for your brain and nervous system, help with satiety, and support overall nutritional health. And that's the real lesson. You don't always need an expensive supplement or some complicated health hack. Sometimes, the most powerful changes start with something simple: a small handful of a nutritious food, repeated consistently, as part of an overall healthy lifestyle. If you learned something new today, please like this video and subscribe to this channel. And if you already eat almonds, tell me in the comments from which country you are and how many do you eat, and what's your favorite way to have them. I read the comments, and I'd love to hear from you. I'll see you in the next video.